Okay. You gotta fix that.
The sneakers.
I know. Yeah, I like that.
Maybe it's that wire.
Yeah.
Sorry about that.
That's all right. You guys ready? Oh. Good afternoon, everyone. I am joined today by 4 members of the COVID-19 Health Inequities Task Force. Frederica Williams, President and CEO of Whittier Street Health Center. Manny Lopes, President and CEO of East Boston Health Center. Suzanne Lee, a community leader and former principal of the Josiah Quincy School, and Karen Chen of Chinese Progressive Association. Yesterday, the task force shared its Health Equity Now plan. This forward-looking plan has at its center a reminder that poor health outcomes are linked to the lasting legacy of structural racism and discrimination based on race, gender, religion, sexual orientation, and even immigration. These factors actually influence a person's health even more than access to health care. They are disparities that affect certain neighborhoods, communities, and specific people differently than others. It is with deep appreciation that I thank all of the members of the Health Inequities Task Force for their dedication to the people of Boston. They are a group of 26 health and human service leaders who were appointed by former Mayor Walsh in April of 2020 to guide COVID-19 recovery and beyond. Their task was to identify and help the city dismantle the root causes of structural inequity through recommendations outlined in this plan. Many of the members served on the front lines of the pandemic as healthcare providers and community leaders, while also informing our citywide recovery efforts. I would like to express my deep gratitude to all of the members for their service and for their brave reimagining of health equity in action. The pandemic magnified pre-existing health inequities, and the past 16 months have underscored the fact that a healthy public is necessary to our city's ability to function and thrive. We cannot return to the way things were before. Our only option now is to go better, and the task force has provided a pathway to a better Boston. As we move forward in our recovery, rooted in a desire to build a healthier and more equitable city than we've ever been, the Health Equity Now plan will serve as an important roadmap. This is why I am proud to announce that I am creating the Health Equity Action Team. The Health Equity Action Team will help to guide the implementation of the Health Equity Now plan. This new team will be charged with a broader scope beyond our pandemic response to achieve a healthier Boston across all of our health metrics. This team will work with city departments to review the plan and see where progress is already being made and where greater attention is needed. They will also lift up the current efforts that I've been leading to ensure the community can weigh in and provide direct feedback on the work moving forward. The Health Equity Plan will inform new investments of the American Rescue Plan funding that will help make our vision of a healthier Boston a tangible reality. We are addressing a lot of the recommendations laid out in the plan through the first round of emergency relief funding. For example, to acknowledge and increase awareness of racism, all city employees are undergoing extensive racial equity and leadership training. To amend our capital budgeting process, I have created Boston's first office of participatory budgeting. To expand equitable procurement, I have hired a supplier diversity team and created the city's first director of strategic procurement, and we have goals for the participation of women and people of color in city contracts, and more importantly, we put in place capacity building resources to achieve those goals. To reimagine public safety, we are taking steps to create a new culture of transparency and accountability in our police force. And my team is also at work on a crisis response pilot to reimagine our city's response to mental health emergencies. As the task force pointed out, investment in our youth is of critical importance. In an effort to galvanize and coordinate all departments across the city working in support of our youth, I've created the city's first Children and Youth Cabinet serving all youth in Boston aged 0 to 24. Boston has an affordable housing crisis that no doubt exacerbates our health inequities. In response, we administered a $50 million rental relief fund to support residents at risk of displacement. But we must do more to make affordable home ownership a possibility for all Boston residents who want to own a home in their community. I invested $2.4 million in the One Plus Boston Mortgage Program to support Boston residents seeking to purchase their first home. With this investment, down payment assistance for Boston residents has increased from $10,000 to $40,000. I was encouraged by several other priorities set forth in the plan, like the call for more affordable and reliable transportation. As someone who has long relied on public transportation, I am dedicated to making Boston's transit more affordable, more efficient, and less carbon intensive. I recognize that all of these improvements will improve the health and well-being of our residents and the people who visit our city. We currently have a pilot underway making blue bikes and Charlie carts free of charge for many employees in our Main Street districts, and we look forward to doing even more. Sadly, this weekend there were several non-fatal shootings in our city. While we have seen public safety numbers trending in the right direction, this weekend was a tragic reminder that violence prevention is a critical part of public health. We have to work together to stem violence in our communities and on our streets. This plan includes important measures to address violence and bring healing and justice to our communities. I want to thank the Boston Police Department for its continued work ascertaining suspects of crime and helping to seek justice for victims. The plan's recommendations will also help shape priority investment areas for the American Rescue Plan funds. And tomorrow we will launch a community engagement process for this federal funding. I look forward to citywide participation. I want to amplify the task force call to leaders from all corners of Boston to join us in addressing the root causes of racial and health inequities in our city. This work requires all of us, not just city government, to come together with our businesses, our universities, our hospitals, our health clinics, our faith-based communities, our nonprofits, and our neighbors to become the healthier, more equitable Boston that we all know we can be. You can find the full plan, the Health Equity Now plan, with recommendations at boston.gov/equity. I look forward to working together with the Health Equity Action Team to create a stronger, healthier Boston. Thank you. I'll take a few questions.
Tomorrow, do you expect the school district to put forward the 100% plan for exam schools or the 80-20 plan, or what is going on?
The question was on the recommendations for the exam schools moving forward. And I want to start by commending and thanking the work group who has worked for months now on offering recommendations. This work group was led by Tanisha Sullivan and Michael Contenpasas, two leaders in our city who care deeply about education and about equity in our schools. I am looking forward to see what the superintendent recommends. I know what is important here is that we create access and opportunity, inclusion and equity, not just for our 3 exam schools, but academic rigor in all of our schools. And so I look forward to seeing the recommendation of our superintendent and what the school committee ultimately decides.
Representative Santiago dropped out of the mayor's race. Any thoughts on that? And also, he says he's looking forward to supporting the first woman of color for mayor of Boston. Will we see
The question was on Representative John Santiago's decision to withdraw from the mayoral race. I want to start by thanking Representative Santiago for his leadership in our city. He has been a champion on a number of issues. He has been a dear friend. He has certainly made the race for mayor more exciting, and he's made me a stronger candidate. I'm grateful for his partnership. I look forward to continuing to work with him into the future. I'm at City Hall right now. I'm happy to talk to you later about endorsements. Are there any other questions?
On the exam school topic, does your office play any role? Like you said, you're waiting to hear what the superintendent recommends. Does your office play any role in that recommendation, or is it up there?
I have long been, for folks who don't know, this was back on the same question around equity in our exam schools. I have long promoted equity and excellence in all of our schools as an advocate working in the nonprofit space long before elected office. I continue promoting equity and excellence for all of our students. It's really important that we all wrap our arms around our young people, particularly now that they have been impacted not 1 school year but 2 school years by COVID-19. And so we have to ensure that all of our young people have every opportunity to succeed, and this is why the Children's and Youth Cabinet is so important.
So does the superintendent make the recommendation, or do you work with her to make the recommendation?
The superintendent is making a recommendation, I believe, tomorrow evening. I certainly work close with the superintendent, as I do with all of my cabinet chiefs. Thank you. Thank you so much.